welcome Alan Jardine, co-chair of the 15th European Society of Organ Transplantation.
Thank you. I'm delighted to participate in this podcast.
We'll be asking you a number of questions regarding the Optimising Patient Care Post-Transplantation Symposium that will be hosted by Roche at the 15th ESOT Congress in Glasgow. Could you tell us, what are the major challenges in the current management of patients post-transplantation?
The major challenges are to prevent rejection, to maximise early graft function, to prolong graft survival, and then a series of challenges that relate to the patient to minimise the complications of transplantation and immunosuppression. And these are specifically to reduce cardiovascular disease, to reduce malignancy, and to reduce infectious complications. The components of these challenges are things like improving compliance, optimising drug dosing and monitoring, and really engaging the patient in the process of transplantation.
Why do you feel it is important to optimise both the short and long-term immunosuppression?
The aims of immunosuppression are different at different stages following transplantation. In the first weeks and months after transplantation, the major complication, the major risk is of an acute rejection episode. And at that time, the aim of immunosuppression is to prevent rejection. As time extends following transplantation, rejection becomes much less of a risk, and it's possible to reduce the doses of immunosuppression. And at that time, we're faced with the long-term complications of immunosuppression, which are nephrotoxicity and impaired graft function, and also the contributions to the long-term complications to the patient of infection, malignancy, and cardiovascular disease.
Why do you feel it's important to prevent CMV infection post-transplantation?
Well, CMV is the most common infectious complication, or it's the most common serious infectious complication. An episode of CMV infection has long-term consequences for the patient. It increases the risk of rejection, either directly or due to modification of immunosuppression at the time of an infection. It's also associated with indirect effects that include an increased risk of diabetes, increased risk of cardiovascular disease, and other long-term complications. So quite apart from the symptoms and the signs of the direct infection to the patient, there are long-term complications that it's important to prevent.
How have the guidelines in CMV management changed over the years, do you feel?
So in the time that I've been a transplant nephrologist, there have been major changes in the guidelines that relate to the availability of drugs to prevent and treat CMV infection. We've gone from matching kidneys to patients according to their CMV status to ignoring the CMV status of the organ of the patient and giving long-term prophylaxis. So in the last decade, we've moved from monitoring CMV infection following transplantation and the early use of anti-CMV therapies to regular prophylaxis for 3 months, and more recently extending the duration of prophylaxis in high-risk patients to 6 months.
What do you see as the key takeaway messages from your session on optimizing patient care post-transplantation?
I hope that people that come to this session will leave with a better understanding of the importance of tailoring immunosuppression to individual patients, to modifying immunosuppression early in the post-transplant period and in the longer term, with the aim of optimising graft function, optimising graft survival, and reducing the impact of immunosuppression on the patient. I also hope that they'll leave with a better understanding of the importance of CMV infection and its direct and indirect effects, and an improved understanding of current strategies to prevent CMV infection in transplant recipients.
Thank you, Alan Jardine. We look forward to seeing you at the Roche Symposium at the 15th European Society of Organ Transplantation Congress in Glasgow, at the Symposium on Optimizing Patient Care post-transplantation, which will be held on Monday the 5th of September from 1 to 2 o'clock in the Lomond Auditorium at the SCCC in Glasgow.
I look forward to seeing you there.